So, Patient Safety Awareness Week is this week, and I wanted to talk about our cosmetic surgery practice at the Langdon Center for Laser and Cosmetic Surgery. So, I think patient safety is probably the number one issue that we think about the most. And we have gone above and beyond, you could say, because uh, to start with, I am certified by the American Board of Cosmetic Surgery. Our office, our facility is accredited by the AAAHC, and we also part of that is ACLS certification on the part of the staff. And I think above everything else, the number one factor that really enhances patient safety, at least in our office, is the use of local anesthesia. So every procedure we do is done with local anesthesia, and because of that, we avoid the risks associated with general anesthesia. And we start by making sure our patients are completely anesthetized. And what that means is that they do not feel anything. So they're numb. And on top of that, we use a sedative. So there are two different concepts. One is feeling. So anesthesia means that you don't feel anything. But the sedative, the sedation is actually a psychological factor. So you can actually be totally numb and still feel kind of nervous about what's going on. So it helps really to have that extra measure. And the sedation we also do in a very safe way. So we always use intramuscular injections as opposed to intravenous. So the patients are very relaxed, but they're not suddenly at risk of having trouble with breathing. So we're always thinking about patient safety, and Patient Safety Awareness Week is a great time to bring that to our attention. You know, we're thinking about it all the time, but you know, it's a good time to really try to communicate with our patients how important patient safety is to us. So you'll notice in our operating room that we have equipment such as an AED, which is an automatic external defibrillator. We have oxygen. We have a monitor, including the pulse oximeter, and we also have other measures that allow for patient comfort. However, a good way to think about the most important part of it all, which is the anesthesia, that is the biggest risk to really to surgery in general, and especially to cosmetic procedures. We avoid the risk. So just by the fact that we are using local anesthesia, oxygen, defibrillators, this kind of material, these safety measures are really, we're not doing anything that increases the chance that they will be needed, which is not true with and general anesthesia, where those are definite risks. However, we are taking safety measures to make sure this equipment is on hand so that, you know, if for any reason we need it, we've got it. So again, Patient Safety Awareness Week is really a great time just to you know, acknowledge all of these factors and how important patient safety is. Thanks.